This video provides an overview of how the team at the Ord Valley Aboriginal Health Service in Kununurra go about contact tracing and explores some of the barriers and tips they have for staff working in regional and remote areas.
My name's Jane Anglis and I work for Ord Valley Aboriginal Health Service as the STI Coordinator, funded by the Syphilis Outbreak Response Program. So here in Kununurra we have high rates of STIs, and in this job it is our role to test, treat and contact trace these clients in an attempt to stop the spread of STIs right across the Kimberley and into the Northern Territory. When somebody tests positive for an STI or a bloodborne virus, we need to get in touch with that person and identify any of their recent sexual contacts to then locate the contact and test them for any STIs or bloodborne viruses and treat them accordingly.
My name's Kirsten Hunter. I work at the Ord Valley Aboriginal Health Service in Kununurra under the Syphilis Response Program. My job role is to assist and help the STI Coordinator, Jane Anglis, in point and care testing and treatment.
Contact tracing needs to happen when an STI or BBV is detected on a lab test or during a clinical diagnosis.
Local staff such as administrative workers, Aboriginal liaison officers or Aboriginal health workers can be imperative in helping you understand where a person may come from or where they may currently be.
If you're new to the role, absolutely working with Aboriginal health workers and Aboriginal liaison officers would be able to help you direct yourself to be able to build relationships within the community, especially with the clienteles that you'll be working with.
Take time to record the patient's contacts during the first visit before the results are available, especially if they have symptoms. Explain to the patient the importance of treating their contacts. Some regional and remote clinics in WA have access to point-of-care testing, which gives STI results quickly to reduce the time before treatment can take place. Always refer to the Silver Book for current information on testing, treatment and management of all STIs and BBVs in WA.
Mind if I bring it with us?
No.
Contacts of gonorrhea, chlamydia and syphilis should be given treatment on the same day of testing. You don't need to wait for the results before you treat them. Explain to the patient the importance of treating their contacts.
Any names that you give to me, private and confidential, mate, it is important that we get these people's names so that we can get out there and test them and be able to treat them as well.
Remember to explain to the patient why they shouldn't have sex for 7 days after treatment, and discuss the importance of using condoms and water-based lubricants to prevent STIs. After the meeting, document the contacts in the patient notes using non-identifying information.
Thanks for that. I'll follow that up now.
Contact tracing can be initiated by a sexual health worker or by the clinician who ordered the tests. The person who reviews the positive result must ensure that contact tracing is carried out.
Could you do a follow-up and treat this client? And
if the contact was referred to you from another clinic, let them know that they have been tested and treated.
I've also had a call from Clumbaroo, the nurse in Clumbaroo.
Yep.
She's got a client who has tested positive to syphilis.
Yep.
She's early stages of pregnancy, so can you contact trace this pretty quick?
Yes, absolutely.
Pregnant women should be prioritised for contact tracing. Make sure you are familiar with your clinic's usual process for following up positive results.
That shouldn't be too tricky. Okay.
Contact tracing can be done through patient and provider referrals and directly in person.
Yeah, we'll come around and we'll see you in about 10-15 minutes.
As well as by phone, SMS, email and social media. You can also contact trace indirectly through websites such as Let Them Know and Better to Know. These sites can generate anonymous text messages. Be careful, other people may have access to the information you are sending them. The length of time that you spend on contact tracing depends on the type of STI and needs to be assessed on a case-by-case basis. Contact tracing is beneficial to be done by a service the client has a relationship with. Building relationships is key when it comes to contact tracing. You should get to know people in the wider community, as well as in the target group.
So if you're new to the role or to the area, it's really important that you get to know your local community. Sometimes it can be very difficult locating somebody, and an idea of where their family might come from or where their families may reside is often key to be able to locate that person.
When you are talking to somebody about the contact, be mindful to keep their medical information confidential.
Wondering, is that someone that you know, or is someone from around here?
You should always meet with the contact in their comfort zone and never be judgmental about their sexual behaviours or choices.
Oh, must be too many, eh?
Oh, can't be. Now just remember, I don't care if there's 1 or 15 names, it doesn't matter. But it's more just about keeping you safe and about keeping those that are around you safe.
How much fish did you catch on the weekend?
With younger clients, a light-hearted approach usually works. Create a relaxed environment where they feel they can easily talk. Reiterate confidentiality as much as possible in your conversations.
I cannot tell you who it is because of the privacy and confidentiality forms that we fill to be able to protect the secrecy of the patients that we deal with. Same goes with you. Anything you tell me, with private and confidential.
Be discreet when talking to people over the phone.
A bit of a yarn about something personal. Are you in a safe place right now and haven't got too many people around?
Do not assume that the person answering the phone is the person you are trying to contact, and make sure they are alone before you tell them the reason for your call. Make an appointment with them so you can talk about it face to face rather than go into detail over the phone.
Knock knock, anybody here?
Remember, insensitive contact tracing can be counterproductive.
Vicky, have you got anybody here?
Yeah, you got some people inside.
Oh sure, no worries. Is it alright if I have a quick chat with you outside?
Try to meet with them straight after the call and treat them at the same time. It is important to be culturally appropriate when contact tracing.
If there is issues within the community, the Aboriginal liaison officer would know the exact situation that's going on, and which assists the health organisation to go into the right direction. Because most people don't necessarily like to come to the table if there's issues and problems going on within the community, and for them to identify it and working with the Aboriginal health workers makes it a lot easier.
In some communities, it may not be appropriate to discuss sexual health or be tested by someone of the opposite sex. But in some situations, there is no choice.
Normally, I would get my colleague Kirsten to come and see you.
Yep.
Just unfortunately this time he's away at the moment and we haven't got a male doctor. So, and I wouldn't do it if I didn't think it was really important.
Yep.
Are you comfortable seeing me?
That's all right.
Are you sure?
Yeah.
Otherwise, I'm happy just to give you the tablets today, and then when Kirsten gets back next week, he can have a yarn with you.
Yeah, fine.
Alrighty?
Yep.
One of the biggest barriers in getting a list of contacts from the patients is that they fear someone will find out. You need to make sure that the person can speak in private and reassure them that the names won't be shared. You can also give patients the option to write the names down if they don't want to tell you.
You can either A, talk to me directly and I can write it down, or B, I walk out of the office and you can write the names down yourself. Do you have any questions for me?
No, just write all the name down of the girls.
Okay, thank you.
Yeah, so we're just going to go check this first place out.
Some people may be difficult to contact trace as they change their phone number and addresses frequently. Sometimes you may only have the first name of a contact or a nickname. In this instance, an Aboriginal health worker or an Aboriginal liaison officer can be helpful in identifying the contact. For more information, refer to the contact tracing guidelines in the Silver Book or contact your local public health unit.